was in horrible pain. Horrible pain in my lower right side, right around where my appendix was. So immediately I was rushed to Englewood Hospital, and it felt like someone was squeezing my hip, squeezing it, and it felt like someone would clench my insides.
Crohn's disease is a disease that affects the intestinal tract anywhere from the mouth all the way down through the entire colon.
My Crohn's disease was so concentrated. It was really in that right lower area of the intestine, the terminal ileum, and it was affecting slightly a little part of my colon and then the appendix. It's not where you see yourself when you're 21. You see yourself hanging out and, working hard, and I let my friends know what was going on. I don't think it was a very public thing to talk about, but I think for anyone to really understand what I was going through was difficult.
Surgery was certainly the right choice for her, and once her surgery was done, her repeated visits to the emergency room, her repeated bouts of abdominal pain completely resolved and have remained that way.
It would take out 1/4 of an inch of my colon and my appendix. It was almost like scooping out this little part on the right, and then they just lift up your stomach and sew it back up. That's the way it was described to me.
We don't look at surgery as a defeat. Surgery is just another of our medical tools to treat patients. So often we'll start with medical therapy, and very often that will work. But if medical therapy doesn't work, it's also important for the clinician to know when is the appropriate time to refer the person to surgery.
The doctors were there the whole time. Englewood Hospital was there the whole time. You had the nurses calling you to make sure that you got all the proper medications. You had the doctors mentally preparing you, saying, things are going to be okay, letting you know exactly what's going to be done. It wasn't a mystery. The personal connection that I felt to these doctors, that's what helped me see the light at the ends of the tunnel. I see myself having Crohn's disease, but I see myself managing it. I think it's a thing that you're in control of. The disease does not control you, you control it. And I feel like in life, I just want to continue to be happy, healthy, and stay close with my family and friends. That's what I value, and that's what will drive me in everything I do.